I'm giving Lasix 20 milligrams IV push for edema. I'm going to check my drug book. Okay, this is a safe dose. It may be given undiluted. Rate of administration is each 40 milligrams or fraction thereof should be given over 1 to 2 minutes. I'm just looking at the precautions to make sure that everything's okay. Everything's checking out. Okay. Now I'm checking the back to make sure that it's compatible with the D5W that's hanging in the room. Okay, and it is compatible. Now I'm comparing it to the MAR, and it is correct. It's the right dose, right time, right drug, everything, right patient, everything's correct. Patient does not have any drug allergies. So now I'm gonna wash my hands. Okay, wash my hands. I'm looking at this to make sure that it's clear, patent, and that it has not expired, and it has not, so we're good to go. I'm gonna scrub the hub.
I'll check any pertinent labs before I give, make sure everything's okay. Everything's fine. So now I'll get my 5 ml thing, I'm gonna label it, I'll put the patient's name.
Okay, I have drawn up my medication. 2 mLs of Lasix. I'm putting the lid on correctly. I've already checked my order, so I know that's good. Now I'm going to go into the patient's room, take some alcohol pads. Before I do that, I'm going to label this. It's got the patient's name and date of birth, or 2 patient identifiers. It's got the name of the drug and the what it is. It's Lasix 2 mils. Okay. So now I'm going to go into my room. Okay, I'm knocking on the door. Hey, I'm Leah. I will be giving you an IV push for that swelling that you've got going on. Your doctor's ordered it, and it should really help with that swelling. Can you tell me your name and date of birth? Okay, I'm making sure that I have the correct patient, and it is correct. Once again, I'm going to check the MAR. Before I get started on anything, I'm going to wash my hands. Okay. Before I get ready to do this, I just want to double check. You don't have any drug allergies, correct? Okay, and this patient does not have any drug allergies. Before I push it, I'm going to make sure that it's patent. So I'm going to hang this down. And it is. So, that's patent. Now I'm going to get this ready. I'm going to take a fresh alcohol pad. And I'm going to scrub the hub.
But before I went to see the patient and make sure that it was a safe dose, it's a safe dose.
Okay.
I went and I checked before I went to the patient's room. And,
so now I'm going to pull this off. Oopsie.
It would flow with the fluids that they have flowing.
I'm going to hook this up. Now before I start to actually push the medication, I'm going to clamp this. I'm going to push a little bit. Push pause method over 2 minutes. You have to push this really slow to make sure that you don't have any kind of reaction.
So now I'm going to wash my hands. And as I'm doing that, I'm going to do some teaching for the patient. Tell them.
You having a good day today?
Mm-hmm.
Good. I'm so happy to hear that. I know you're ready to get out of this hospital. I'm just kind of making small talk with the patient so they don't feel uncomfortable. It's already kind of scary being in the hospital.
The labs that I'll be watching will be like their CBC,
So,
for the H&H and such. And also, another pertinent lab I'll be watching for just to get Lasix will be compatible. So now what I will do,
still pushing this
I'll
med.
find the port closest to the patient, which is this
Longest 2 minutes ever, huh?
my alcohol swab. And I'm gonna give the medicine compared to the MAR, which is Lasix.
And before I even push this, in addition to making sure that it's patent, I'm just looking at the IV beforehand to make sure that there wasn't any redness, swelling, warmth going on, and none of that was going on. Patient was comfortable, and they did not have any issues with their IV. Okay, still pushing. We're about halfway through.
So into the sharp container and the garbage. And at this point, I will, chart based
Okay.
on where there was stat, PRN, I'll chart the by rights, the patient, the route, the medicine, and the time and date, and then I'll sign my documentation, and then that will complete my IVP back. So now, I'm gonna do my that was my IV push, now we'll start my IVP back.
Okay. So we have
I'm gonna check my medication.
successfully pushed this over 2 minutes. Gonna unclamp this. Gonna take this off and dispose of it in the sharps container, along with the needle that I drew it up with. And just because I am the way I am, I'm gonna clean this hub again.
So this time I'll get the medication.
Okay. Patient's still comfortable, no signs of infiltration, everything still looks good on the IV. So now I'm going to document what I just did, that it was the right patient, right dose, right route of administration, and that's it.